Hi, my name is Sabrina Coelho. I'm here today to record my CPE related to the head to toe assessment to the class in Nurse 242 lab. First of all, before getting to the patient's room, I'm gonna announce myself. One way to do that is knocking the door, and I'll ask the patient for me to come in. After that, I will wash my hands and introduce myself. Hi, my name is Sabrina. I'm your nurse today, and I will, after introduce myself, I will close my door or my curtain for privacy. And I will explain to my patient what I'm here today, what I'm supposed to do today. So I'm gonna start my physical assessment with my patient. Hi Tony, my name is Sabrina. I'm your nurse today. How are you today?
Doing okay, thank you.
All right. Tony, can you tell me your full name and your date of birth?
Tony Coelho, July 13, 1961.
Do you know which day is today?
Today is Wednesday, June 10th,
How about the year?
2020.
Okay. Do you know where you are right now?
I am in Oldsmar, Florida.
Okay. This is a way that I can see that my patient is alert and oriented. Time for 5. So Tony, I'm here today to do a physical assessment on you. It is okay for you. This is the best time for you.
Yes,
This is include some palpation. Do I have a permission to touch on you?
yes,
Okay, I'm gonna start from the head to toe. I'm gonna first of all to see your scalp, your head. I don't see any redness, any bumps, any open areas. Tony, do you have any complaint about pain to your head?
no, I don't.
Okay, are you able to close your eyes?
Yes,
Can you open your eyes for me? I'm gonna put a light to your eyes just to see your pupil reaction, okay?
yes,
All right, it is reacting to the light. So Tony is able to open his eyes spontaneously. The mucus is pink and I don't see any drainage, no signs of infection related to his eyes. Tony, can you turn your head to your left side, please? So I'm gonna see your ears. I don't see any redness, no presence of wax, no any lumps around. Do you have any pain when I talk to your ear?
no, I don't.
All right, can you turn to the opposite side? Yes, no redness, no drainage, no ganglions, or anything to your ears. Everything's okay. How about your nose? Do you have any drainage or any complaint about breathing?
No, I don't.
Okay, I'm gonna check your nose as well. The mucus is pink, no drainage noted, no septum deviation noted. Can you open your eyes for me, please? I mean, your mouth. Do you have dentures, Tony?
No,
No, you don't. Okay. Do you have any loose teeth?
no, I don't.
Okay. I see that you have all your teeth to your mouth, so it's permanent teeth, right?
Yes,
All right. So your tongue is at midline. I don't see any deviation to the tongue to his mouth. About your neck. Now I'm gonna examine your neck, Tony. Can you extend your head? Thank you. So the neck, the trachea is at midline. So the carotid pulse. I'm gonna check the carotid pulse. It's positive bilaterally. Can you turn a little bit? I don't see any jugular jugular vein distension to his neck. No ganglions, no palpation, no lumps, no bumps. All right, Tony, now I'm gonna check your chest. Um, I'm gonna keep your shirt on just for privacy because we are recording that. But the idea is to auscultate your lung sounds and your cardiac sounds without the shirt or under your hospital gown. Um, First, I'm gonna check your skin. The best way to check in skin, this is a good area to see the turgor and the elasticity. So it's normal, it's pink. I can see that your chest is symmetric. Can you take a deep breath for me? The lung expansion is even to both sides. I can see the lung expansion equal. Now I'm gonna auscultate your lung sounds. And I'm gonna ask you every time that I move my stethoscope, can you please take a deep breath for me?
Sure.
Thank you. All right, I'm gonna auscultate the tracheal sound. Now the bronchovesicular sound. Now the vesicular sound. Okay, Tony, your respiration is regular and vesicular. It means that's normal, soft breath sounds. I didn't see any abnormality. And to all your lungs fields. So can you turn it to your left side, please? I need to auscultate to your back. One more time, the ideal position, way to do this without the shirt. Can you please take a deep breath? All right, you can come back to your position. Now I'm gonna evaluate your cardiac system, but before I'll auscultate your cardiac sounds, I would like to talk about some landmarks. This is your sternal notch, your angle of Lois, and those are some landmarks that we use it to auscultate the cardiac sounds. The sounds from your heart. So the first sound that I'm gonna auscultate is the aortic sound. It's located at the second intercostal space to the right sternal border. Okay, the pulmonic sound to the second intercostal space to left sternal border. The tricuspid sound to fifth internal costal space to lower left sternal border. And and the strongest sound to the apex of your heart, we call apical pulse, to fifth internal costal space at mid-clavicular line, okay, Tony, your apical pulse is regular. I didn't see any sounds different than normal. Now I'm gonna evaluate your upper extremities. So it includes your arms, your elbows, your shoulders, the articulations. Can you move your arms? All the way up, all the way to the side. Yeah. Do you feel any pain?
No.
So you have your range of motion. Range of motion is normal with normal limits. Can you do the same with your left side? I mean, your left arm, please. So the range of motion is with normal limits. The skin is intact. I don't see any issues or any redness, any rash to your skin. It's warm. The color, it's normal for your skin color. Your nail of bed. Your nail of bed is pink, intact. I don't see any abnormalities to your nails at this moment, no deformities. Your capillary refill, it's brisk, less than 3 seconds. Okay, now I'm gonna check your abdomen. Do you have any complaint about your abdomen?
No.
No. When was the last time that you had a bowel movement?
At this morning about 11 a.m.
Okay. It was regular? You had any diarrhea?
No.
Do you have any issues about constipation?
No.
Okay. First I'm gonna listen to your bowel sounds, and after that I'm gonna do the palpation. So I'm gonna start to hear the bowel sounds from your right lower quadrant. And I'm gonna hear those for a full minute. So every quadrant I have to hear your bowel sounds for a full minute. So the next is gonna be your right upper quadrant. Your left upper quadrant. And your left lower quadrant. So your bowel sounds are active to all 4 quadrants. It's normal. I don't see any masses. Your abdomen is flat, is soft to palpation. How about your genital area? Is everything okay? Do you have any complaint? Do you have any redness?
No.
No? Okay. For privacy, and this is about my patient's wishes as well, I'm gonna trust on him, and this is again a recording. It's still a private to my patient. So Tony, now I'm gonna see your lower extremities. So are you able to move your legs? Can you do this for me, please, like you did with your arms? Are you able to lift it up, to put it down, to bend your knee? Yeah. Okay. How about the left leg? All right. Do you have any surgeries to
No.
your lower legs?
No.
All right. I can see you don't have any open areas. Your skin is intact. I can see all the hair distribution is even. You don't have any missing spots to your lower legs. I'm gonna palpate your femoral pulse. Is this okay for you? Is it to your groin area?
Okay.
It is okay for you for me to touch?
Yes.
Okay. Okay, it is positive to both sides. Now I'm gonna palpate your popliteal pulse. It is located behind of your knee. Can you just bend your knees a little bit? All right, it is positive, and I would say +2 because it's normal. I can feel really well. It's strong. Now I'm gonna palpate your tibialis, tibialis pulse. Is positive as well. I would say +2. Now your pedalis pulse, dorsal pedalis pulse, dorsal pedis pulse. Yeah, it's positive, it's +2. I can see the capillary refill to your toes are brisk, less than 3 seconds, and I think everything is okay with you, Tony. Thank you so much for everything. I just wanna make sure that and clear that during my physical exam, I'm supposed to have my gloves on, and it's very important to wash my hands before the procedure and after the procedure. So let's pretend I had my gloves on during the whole examination. Okay? Thank you so much for everything.